All right. Hi, look who's here. What's your name?
Angela.
Hi, Angela. And you're here to tell your story. I mean, you're here to see me, but to tell your story because your story is particular, right? And it's everybody's scared about that. But we did a very extensive surgery, and then you ended up with a colostomy.
I ended up with a colostomy after removing my adenomyosis.
Right.
And
you had disease on the bowel too, and we did a lot of surgery there, right?
yeah, and my uterus was like huge when it came out. So I woke up with a colostomy, and I was nervous. I was scared because I didn't know what I was doing. They had a nurse show me, and for like the first 2 weeks, I had my mom changing it for me because thankfully she's a nurse.
Yeah.
But then I was having like some irritations, and I went
see. Let me ask you a little bit more about obviously something is that people's biggest fear, right? Were you really scared? I mean, tell me about your fear. Were you angry? What's it?
I wasn't angry. I was just like, oh man, why? I was just like, why me?
Right.
So I wasn't expecting it.
Right.
But I had such good nurses, and there was a local ostomy center.
Right.
I even had it was almost like an innie. My ostomy was retracted, so I would get these like granulomas around it.
Right.
And I would have to go to the nurses to
clean it.
Yeah, and
it's very stressful, right? And very few doctors talk about this stuff, but I feel that people should discuss these things because they do happen, that people need these things done, but it's always temporary, now it's gone and you feel free and liberated. Are you okay now?
I feel amazing, and I also once I got used to it, I wasn't scared of it anymore. I became an expert. I was able to change it every morning before, twice a day, not twice a day, a couple times a week, and every morning when I showered, I knew what to do. And I became comfortable with it, actually. Not that I wanted to have it, but I learned how to live with it. And
now it's gone.
It's gone.
I thank you for sharing your story. And people are like, oh, you're talking about, because it's a big taboo and it's a big scare too, right? It's something that everybody's biggest fear. But sometimes you can't remove the disease on the bowel without having to do these procedures. And it's just a reality of what we do, and it can be tough. But obviously also you have a special personality, right? And you're a very positive person.
And I'm just so grateful, Dr. Vidali, because you and Dr. Pagazzi really changed my life for the better.
Thanks for saying that.
I can't even recommend you enough, to anyone going through endo or adeno. It was the best thing I ever did, because even with the colostomy, I was still living so much better than when I had adeno and endo. And now that it's gone, I'm a totally different person. I'm not living in pain. And it changed my life. I was living in pain for so long.
Well, thank you for your kind words and for your honesty and the courage and telling your story. Thank you.
Bye. Thank you, Dr.
Thank you.